1. Snoring respirations are most rapidly managed by A. Suctioning the oropharynx. B. Initiating assisted ventilations. C. Correctly positioning the head. D. Inserting an oropharyngeal airway. The answer is C. Correctly positioning the head. 2. Which of the following patients would be most in need of a rapid trauma assessment? A. An awake and alert 19-year-old man with a small caliber gunshot wound to the abdomen. B. A conscious 25-year-old woman who fell 12 feet from a roof and landed on her side. C. A 43-year-old woman with a unilaterally swollen, painful deformity of the femur. D. A 60-year-old man who fell from a standing position and has an abrasion on his cheek. The answer is A. An awake and alert 19-year-old man with a small caliber gunshot wound to the abdomen. 3. Which of the following bones is affected with a swollen, painful deformity to the lateral bone of the left forearm? A. Ulna. B. A radius. C. Clavicle. D. Humerus. The answer is B. Radius. 4. During your assessment of a 34-year-old man with a gunshot wound to the chest, you note that his skin is pale. This finding is most likely caused by A. A critically low blood pressure. B. Increased blood flow to the skin. C. Decreased blood flow to the skin. D. Peripheral dilation of the vasculature. The answer is C. Decreased blood flow to the skin. 5. An 80-year-old woman has pain in the right upper quadrant of her abdomen and a yellowish tinge to her skin. You should suspect dysfunction of the A. Liver. B. A spleen. C. Pancreas. D. Gallbladder. The answer is A. Liver. 6. Which of the following situations is an example of abandonment? A. An EMT paramedic gives a verbal report to any emergency nurse. B. An EMT intermediate assumes patient care from an EMT basic. C. An EMT basic transfers care of a patient to an EMT paramedic. D. A first responder assumes patient care from an EMT intermediate. The answer is D. A first responder assumes patient care from an EMT intermediate. 7. Which artery should you palpate when assessing for a pulse in an unresponsive 6-month-old patient? A. Radial. B. Carotid. C. Femoral. D. Brachial. The answer is D. Brachial. 8. During the initial assessment of a trauma patient, you note massive facial injuries, weak radial pulses, and clammy skin. What should be your most immediate concern? A. Potential obstruction of the airway. B. Internal bleeding and severe shock. C. Applying 100% supplemental oxygen. D. Providing rapid transport to a trauma center. The answer is A. Potential obstruction of the airway. 9. You are called to treat a male patient who overdosed on heroin and is unconscious with shallow breathing and cyanosis to the face. The patient suddenly begins to vomit. What should you do first? A. Suction the oropharynx. B. Turn the patient onto his side. C. Insert an oropharyngeal airway. D. Assist ventilations with 100% oxygen. The answer is B. Turn the patient onto his side. 10. The scene size up includes all of the following components, except A. Determining scene safety. B. Applying personal protective gear. C. Assessing the need for assistance. D. Evaluating the mechanism of injury. The answer is B. Applying personal protective gear. 11. In which of the following patients would an oropharyngeal airway be indicated? A. Any patient suspected of having hypoxia. B. A semi-conscious patient with an intact gag reflex. C. The semi-conscious patient who took an overdose of propoxyphene. D. An unconscious patient with fluid drainage from the ears. The answer is D. An unconscious patient with fluid drainage from the ears. 12. Upon arriving at the scene of a multiple vehicle crash, you can see that at least 2 patients have been ejected from their vehicles. What should you do next? A. Begin triage. B. Treat the most critical patient first. C. Gather all of the patients together. D. Call for at least one more ambulance. The answer is D. Call for at least one more ambulance. 13. A 75-year-old man has generalized weakness and chest pain. He has a bottle of prescribed nitroglycerin and he states that he has not taken any of his medication. After initiating oxygen therapy, you should next: A. Apply the AED and prepare the patient for immediate transport. B. Perform a detailed physical examination to locate any other problems. C. Contact medical control for permission to assist the patient with his nitroglycerin. D. Complete a focused physical examination, including obtaining baseline vital signs. The answer is D. Complete a focused physical examination, including obtaining baseline vital signs. 14. Which of the following organs is not part of the endocrine system? A. Thyroid. B. Pituitary. C. Pancreas. D. Gallbladder. The answer is D. Gallbladder. 15. Which of the following injuries or conditions should be managed first? A. Fluid drainage from both ears. B. Bleeding within the oral cavity. C. The large open abdominal wound. D. Bilateral fractures of the femurs. The answer is B. Bleeding within the oral cavity. 16. You arrive at a residence where you find a man lying unconscious in his front yard. There were no witnesses to the event that caused the unconsciousness. In assessing this man, you must assume that he: A. Has sustained an injury. B. Is having a heart attack. C. Is having a diabetic reaction. D. Is having a heat-related emergency. The answer is A. Has sustained an injury. 17. When is the best time to perform a detailed physical examination? A. While en route to the hospital. B. After all life threats have been ruled out. C. Immediately after taking baseline vital signs. D. Following the initial assessment of a trauma patient. The answer is A. While en route to the hospital. 18. Which of the following conditions would most likely cause flushed skin? A. Shock. B. Hypoxia. C. Exposure to heat. D. Low blood pressure. The answer is C. Exposure to heat. 19. During the rapid trauma assessment of a patient with multiple injuries, you expose the chest and find an open wound with blood bubbling from it. What should you do next? A. Apply 100% supplemental oxygen. B. Provide rapid transport to the hospital. C. Prevent air from entering the wound. D. Place a porous dressing over the wound. The answer is C. Prevent air from entering the wound. 20. You are called to a local park for a 7-year-old boy with respiratory distress. During your assessment, you find that the patient is wheezing and has widespread hives and facial edema. What should you suspect has occurred? A. Heat emergency. B. Allergic reaction. C. Acute asthma attack. D. Exposure to a poisonous plant. The answer is B. Allergic reaction.